Sitting is worse than smoking. If you have a sitting job, buy a standing desk. Set your iPhone alarm every 30 minutes to get up and walk. To lubricate your joints, the large artery behind the knee called the popliteal artery, vein, and nerve, it actually does get compressed.
Is running actually bad for your knees?
Running is not bad for your knees. You see people running well into their 90s. As long as you keep the body symmetrically correct, as long as the body stays strong, you can run forever. I will tell you, must live my 5 pillars of longevity. Pillar number 1 is sleep.
Dr Lisa Corsa, welcome to the LiveMore Podcast, where we dive deep into longevity, health optimization, and keen to get your perspective on what you focus on in terms of your longevity practice over in Boca Raton, Miami, Florida. We met in Davos back in January. And yeah, so I think this is an interesting episode because a lot of people are data rich, focusing on, for example, tracking their sleep, their biomarkers. But I think it's interesting because one thing that I don't think is nearly spoken enough about is how well you're actually moving. Things like structural durability. And I think it'll be good to unpack that with you a little bit more in terms of like biomechanics as well, which is something that you're focused on as a doctor of physiotherapy. So without further ado, I'd love for you to introduce yourself to my audience and explain what got you here, what is your background, and yeah, I'll let you take it from here.
Well, thank you so much for having me, Rob, on your amazing LiveMore podcast here in cold London. It's a far journey from hot, sunny Florida. But thank you. Yes, I own Premier Therapy Solutions located in Boca Raton, Florida. And I love your sentence of structural durability. As a physio doctor and a manual osteopath, I've spent 30 years of my life breaking down the human body into simple physics, chemistry, and biology. And from there, I've been able to unpack and uncover root cause of pain. And then once you've uncovered the root cause, then I create the algorithm and the solution to fixing it. It's been wonderful. It's been a great journey. My clinic in Boca Raton is called Premier Therapy Solutions. It's a private medical concierge facility. And we have all types of physicians, allopathic, clinicians, physio, osteo, neurology, cardiology, that we bring in to really solve complex cases.
Fantastic. And I hear you also have experience working with elite athletes. It'll be interesting to see what sports are you seeing the most injuries come up in terms of like, is that more towards like sports where there's change in directions, like football, soccer? A lot of people are running, so there might be overuse injuries there. So I think there's a lot of nuances in terms of what kind of sport you're actually playing or doing. It'd be interesting to see what your take is on that in terms of what you're actually seeing every day in your practice.
So as far as the elite athlete, let's talk about 3 types of athletes. The weekend warrior, right, that just goes out and says, let me play 10 rounds of golf, or I'm going to do pickleball or tennis. Then you've got the collegiate athlete or high school athlete, and then you do have the elite professional. And really, for all of them, it boils down to something very simple, whether you're the weekend warrior or the elite athlete. And the word really is recovery. The recovery protocols you do, which is part of my Corsa method, helps to prevent injury, helps to prevent, seriously, massive fractures, or like you said, the cutting, sprinting type of, we're going to see injuries in football all the time. ACL injuries, soccer players have those injuries. But I sit there and say, but what about that soccer player who never got that ACL injury? Why? Because their recovery off the field and off the court was at the top level of the game. And that's truly how we avoid these injuries. Sure, rugby, they have terrible injury. Downhill skiing, you heard what just happened with Lindsey Vonn. I mean, these injuries are devastating. They're not career ending though. They're not. The body can heal. So you name the sport, I'll tell you the injury, top three. I always love to play that game. My son said, Mom, well, how come you won't let me play football? Because of these top 5 injuries that occur. So, even though he's 6'5" and 200 pounds, no, you're not going to do it. I don't want you to get a head injury, an ACL rupture, or rupture your rotator cuff.
Absolutely. I'm someone who's big on running, so run often, average probably about 4 times a week. So I think a big myth that'd be interesting to explore with you is running actually bad for your knees?
I will tell you that running is not bad for your knees. You see people running well into their 90s. As long as you keep the body symmetrically correct, meaning muscle symmetry, as long as the body stays strong, and as long as the body stays mobile in the joints, you're not going to injure yourself. You can run forever. So the key factor is make sure when you're a runner that you do supplement in the gym. You must supplement because let's face it, running does not work all 636 muscles in the body. So you need to supplement with those muscles that become dormant in runners, i.e. the glutes. The glutes actually, gluteus maximus, medius, and minimus, are not strong in runners at all. They're not. Now, sprinters is a different story. But running, long distance, weak glutes. They even get a muscle that becomes very weak called the peroneals. The peroneals are a group of muscles based on the outside of the lower leg, on the lateral side of the leg, that are so important for stability of the ankle, the knee, and the hip. So when that whole group of muscles weak, you can then break down the knee joint and the hip joint. So you must, find someone like me who does the full analysis and says, you're wonderful for these muscles in running, but these are the 35 you're not working, and you better work those in the gym. That's how you stay not injured in running and run till you're 100.
That's fascinating. A lot of us, when we go to running stores, we get what's called a gait analysis done. So it checks, for example, whether you're overpronating or underpronating. But is there more to it? Would you say that a gait analysis isn't really uncovering your full biomechanical range and movement? And it's not probably sufficient in terms of determining what running shoe is appropriate to you. I think there's a lot more to it than just appropriate running shoe.
Correct. I would say the gait analysis you get in the running store is very rudimentary. It really is only looking at a few pieces in a moment of time. You need the full body biomechanical analysis. Again, that's what I do at Premier Therapy Solutions. So we are assessing your 360 joints, 206 bones, and 636 muscles. The gait, we're doing posture, coordination, balance, gait, all of those jumping mechanics. That's really what's going to keep your body symmetrical. And you can buy any shoe in the world. I've tested a lot of different shoes on different companies. And I will tell you, there are some specific shoes that I'm going to say are absolutely not good. And then there's shoes that are phenomenal. And I'm going to give you those top 5 reasons why. We all have so many different types we like. But analyzing shoes from a physics perspective, I'm going to tell you that this shoe's not good because it's shifting your ground reaction force anterior to the hip, which is going to load the lumbar spine. So you've got to be careful with these fad things with the carbon fiber. Sure, are they good part-time, but not full-time? It's just like barefoot running was a fad, right? There's nothing wrong with barefoot running, but not forever. You need to take everything in moderation. Is barefoot running great on a beach for a little while to strengthen the foot intrinsic muscles? Absolutely. But I wouldn't tell you to do it every single day. So I think getting a full analysis if you're a runner once a year is really required to stay running injury-free.
Absolutely. Does it matter, for example, if you're heel striking or actually what point is actually in contact with the ground every time you're impacting it? Is there a nuance around that as well?
There's a main nuance with the heel strike. So there are 6 phases of normal gait, okay? And initial contact is when the foot is in 20 degrees of something called dorsiflexion. So with dorsiflex, we strike the heel on the ground. The problem is most people don't even have a normal range of motion of the ankle joint. So every time you're striking the ground, you're striking it at a 50% less range of motion, which then creates this abnormal deleterious force up the kinetic chain through the tibia, the femur, the hip, and the spine. And that creates this abnormal ground reaction force. So when we run, let's not forget that we have gravitational force at 9.8 meters per second squared coming down on us, and our muscles need to co-contract to keep the joints stable. So if the muscles don't co-contract when we're running, you're going to get shifting of those joints. And that's where you get wear and tear of the meniscus breaking down, like you said, in the knees. Or you can get wear and tear in the labrum in the hip. Or runners, believe it or not, actually get vertebral compression in the lumbar spine. So they say, I have the worst running back. But then I'm saying, but how do you have a runner who's 75 years old and has no arthritis in her spine? Why? Because she kept her core strong. So supplementing in the gym with some planks is a phenomenal exercise to keep the core. Front plank, side plank, those are just wonderful things to keeping that core strong. Doing some specific exercises to strengthen the rectus abdominis and the multifidus and the erector spinae, which are the key muscles for when you're running, is vital. And you should really speak to your physiotherapist and say, give me this prescription so that I can stay running safely.
Absolutely. Posture has a lot to do with as well, how you're sitting every day. One of the things that keeps coming up is sitting is become the new smoking. So sedentary behavior and the impact it has on the body. And I was actually looking into this because I flew recently to the US, so London to LA, it's around an 11-hour flight. And it's interesting to look at one particular study that shows there's like a 50% reduction in blood flow in the artery behind your knee. So just showing you there what's happening on a long haul flight. And if you're constantly sitting down during your workday and not getting it up enough, that can cause a lot of issues as well in terms of your posture, right?
Absolutely. You said it right, Rob. Sitting is worse than smoking. Sitting is deleterious to the human body. It is. If you have a sitting job, buy a standing desk. Set your iPhone alarm every 30 minutes to get up and walk, to lubricate your joints. And that is correct. The large artery behind the knee called the popliteal artery, vein, and nerve, it's all there. It actually does get compressed. So when someone says, why are my legs swollen? Because you're not moving on an 8 to 10 hour flight. And when you get fluid inside a joint, it infiltrates a muscle and renders the muscle inactive, and the nerve becomes latent or lazy. So now the nerve doesn't, contract correctly, and then the muscle doesn't work right. So that's why we're back to recovery. Getting those compression boots that you can wear after a long haul flight, doing my Corsa conditioning kit on a long haul flight, doing 20 minutes of exercise, moving the limbs, getting up every 30 minutes, and doing small little exercises is very simple, and that's what I came up with.
I just thought of a very simple biohacking protocol that's often used, and that's, I think, red light therapy. Do you believe in that? Do you think that actually is helpful?
I believe in red light therapy. I offer red light therapy at my clinic, Premier Therapy Solutions in Boca Raton. Red light therapy activates a cascade of cellular events to promote healing, to reduce inflammation, really to help with cell regeneration. Absolutely believe in it.
Fantastic. I actually use one of those air compression boots as well. I find it helps.
There are so many types of air compression boots out there. The latest one that I use in my clinic is a very specific one that actually changes the millimeters of mercury of compression per compartment of the leg. So I can adjust the foot to be a stronger pressure than the calf, than the thigh, than the hip. It's fantastic. And then it's gradient. So it pumps and creates that actual vascular pump that you lose staying sedentary. So it's a phenomenal product. I use it. It comes with a backpack. You can take it anywhere, any place. And again, really good for recovery and rehabilitating, because if your legs are swollen, they are not going to perform well.
Absolutely. Are there studies that show that these air compression boots, that the effectiveness of it?
100%. Mueller is a phenomenal company that I, have partnered with over the years. They have spent millions of dollars globally, worldwide, in R&D, research and development, for these types of boots. One of their products is called the Revive, and it's fantastic. I have it on my website. There are multiple studies at how this improves vascular pump, reduces inflammation, really helps with the blood flow circulation, and decreases pain.
And what about heat therapy and cold therapy? So a lot of people are, for example, using ice baths. What are your thoughts around that? Using the sauna? I use the sauna for recovery, particularly after strength training, but definitely don't use cold therapy after strength training, because I've heard that it's not great for strength training. Doing it straight after strength training.
Yeah, right. So I use cryotherapy in my clinic.
Right.
I also use infrared sauna. I have a phenomenal sauna. Cryotherapy is definitely indicated when you injure something. So if you've got an acute injury, putting ice on an injury really does help and stop that inflammatory process. There's also ice baths, cryo baths, 2-3 minutes has been shown to, really boost the metabolism recovery. The footballers, after playing, 8 hours, they'll jump in that cold bath. There is some literature to discuss that cooling of the body helps to decrease swelling, inflammation, and pain. There's for sure some studies there. There are controversial studies that if you do it actually pre-strength training or post, it can delay healing times. So again, you've got to use it in the context of what the injury is. I recommend doing it for injuries. Okay. Infrared sauna, a lot of research and development for sleep, inflammation, weight loss, stress, anxiety, all of those things. I really do believe in infrared sauna daily. They even use it on cancer protocols. Some of the largest cancer institutions in the world were doing infrared saunas. So I think a sauna is very good.
Absolutely. I try and use the sauna as well. But I've looked at the Finnish studies, and I think they show that the dry sauna, you don't have to spend as much time for the equivalent benefit when compared to like a red light sauna. Apparently you have to spend, I think, approximately 40 minutes in a red light sauna compared to 20 minutes in a Finnish dry sauna.
Correct. That is correct. The dry saunas back in the old days, remember those were the original saunas. And, people would, go completely naked in that sauna and really get that benefit. The dry heat penetrates what's our largest organ in the body? The skin. So the dry heat penetrates that skin and it activates this, cellular events again quicker because it gets into the body faster. Somehow with the infrared sauna, with the light combined, it's not getting there as quick and creating that cellular cascade of events. But regardless, they're both really good. I would recommend both of them, if you have, depending on what region of the country or the world you're in.
Fantastic. Just a shift in direction here. Lower back pain. So there's evidence to show that lower back pain is the leading cause of disability. I think in a study done in, I think it was 2020 in the Lancet, if I'm not mistaken, 619 million people have been diagnosed with some kind of lower back pain issue. And this is predicted to increase by 2050. So just wondering what your thoughts are around that and how that can be minimized or prevented for as long as possible.
I'm so glad you're bringing this topic up. Chronic low back pain is the number one cause of disability in the world. It is 90% of the cases I see. That's why I developed the algorithm to fix chronic low back pain. Everyone is fixed. First, you've got to get to the root cause of the pain. And that takes time. You have to dissect medical records, dissect MRIs, blood work, all the failed epidurals, failed back surgeries. Did you know that's greater than 70% of back surgeries are failed? Failed back surgery syndrome is something I treat. And we sit here and say, why? Because surgeons aren't attacking the root cause. There is only one or two reasons why you actually need surgery. So when you come to my clinic, I'm going to do my full exam. It takes a couple of hours. And there is that small, minute chance that I'm going to say, don't waste your time and money with me. You need back surgery now. But I'll tell you, Rob, I rarely say that. I'm going to say, you must spend the time for this next year to fix your back. The back is fixable, but it's leading to opiate addiction. Do you know the world is addicted to opiates, and then you don't sleep. And now you're not sleeping, you're on drugs, and your back pain gets worse and worse, and you go through this pain spasm cycle. And then they keep giving you cortisone shots, and that doesn't work. So we must get to the root cause, and a lot of times the root cause is a biomechanical mishap, malalignment, an abnormal length tension on the muscle and the tendon, an abnormal ligament that's stretched beyond its anatomical limit. That's what I find. That is why I do what I do, and that's why I fix chronic low back pain.
What I find fascinating is that you can be metabolically healthy, have perfect biomarkers and biometrics, but yet have very poor biomechanical movement and mobility, which I don't think, again, is nearly discussed enough. And I think when it comes to longevity is not just about living longer, it's about performing better in everyday life. And I think structural integrity, joint movement is fundamental to that. So in terms of protocols that the everyday person can implement, let's say you've got someone that's desk job bound, they're going to the gym 3 times a week and they still feel stiff. What would you advise or suggest to that particular individual?
If you're going to the gym 3 to 4 days a week, I will tell you, you must live my 5 pillars of longevity to stop that stiffness. There's no reason for you to have joint stiffness, but you've got to attack the 5 pillars. Pillar number one is sleep. So if you don't get 8 to 10 hours of sleep, you don't activate those recovery mechanisms at night to clean out the joints, to clean out the microglial system in the brain, which contributes to the amyloid tau plaques and Alzheimer's and dementia. You must get that 8 to 10 hours of sleep, avoiding alcohol, blue light, the televisions at night. Sleep is number 1. Number 2 is exercise. You must exercise, in my opinion, 7 days a week. There's nothing wrong with going to the gym 7 days a week. I do. I work different body parts. I stretch different things. I activate different types of contractions. There are 3 different types of contractions. I'll do eccentric contractions, concentric contractions, isometric contractions. That's what's creating injuries. People just work out in a specific motion. That's creating the injury, even in the 20-year-old. So exercise is number 2. Number 3 is nutrition. Food is medicine. You are what you eat. You must focus on eating a minimum of 1 gram per kilogram of body weight in protein to build muscle, maintain lean body health, and keep well. Protein, eat. Avoid those anti-inflammatory foods. But number 4 is really important because you just mentioned it. It's actually called stretching. If you don't stretch, you're not going to reset the length tension of the muscle, 636 of them. You're not going to reset the length tension. Now you go ahead and do the bicep curl again, and you didn't lengthen it back to its normal length, and it gets injured. Nobody stretches, and we're sitting and getting tight and short. Stretching is vital, and part of my Corsa method is stretching. And the last part of my 5 pillar of longevity is definitely something called meditation, mindfulness, social engagement, doing something that you love. Get out and take a walk with some vitamin D. Maybe do a 5 minutes of meditation. Close your eyes and breathe. Put on some classical music. Meditation can look in any form, any shape or form. So if you practice those 5 pillars, that 30 something, 40 something, or even 50 something, I promise you that stiffness will go away.
Absolutely. Just wondering, in terms of, you said that you've seen a lot of patients that have had a case of, too many failed surgeries. Just wondering, at what point would you see a patient and say, okay, we've done everything we can in terms of, biomechanics and whatnot. At what point might you refer them to, let's say, take a look at surgery as the next option?
I would say first of all, let's talk about failed back surgery syndrome. Why does the back surgery fail? It's not the surgeon's fault. It's your fault for not completing the rehab and putting the body back in its normal biomechanical alignment. So truly, the only time I say to someone you need surgery is if you have a drop foot. The nerve is compressed so much that your foot is now paralyzed and you can't move your foot. Well, that's a surgical intervention you need. There's also something called cervical myelopathy. That is an intervention that you need surgically. It's when the spinal cord is so compressed that the electrical signal's not getting down to the limbs and you're dropping things. You can't button, you can't zip, you can't type. That's serious. Or you're tripping and falling because your foot is paralyzed. But truly, those are the only reasons for back surgery. Just as general low back pain or herniated disc, a disc is fixable. Your herniated disc can resorb back into the body. It's called disc resorption. It occurs in every disc. It takes 18 to 24 months. With excellent physiotherapy, you don't need back surgery.
Absolutely. I think a common procedure is getting a knee replacement, I think, at some point in time. I don't know at what age that commonly happens, but how can one avoid those kind of things?
So let's talk about joint replacements. I treat so many joint replacements. I have a prehab program where for 6 weeks, I prehabilitate you before you go under the knife so that when you're post-op, you don't need pain medicines, you're up and walking same day, next day, and your rehab is expeditious, you're done and done, back on the golf course. However, I'm trying to avoid you to get a knee replacement or a hip replacement. And that comes with the big global term osteoarthritis. Let's face it, what do you need a hip replacement for, or knee? Because you had the wear and tear and breakdown of the joint. You didn't live the 5 pillars of longevity. You didn't practice the Corsa method, and you broke down the joints. The recovery needed to happen. So these total joint replacements usually only happen from wear and tear. And why do we get wear and tear? Because you didn't do the saunas, you didn't ice the joint, you didn't stretch after you worked out. You just kept doing squats, lunges, but you never stretched the muscles after. So these joints, honestly can repair. And then you didn't sleep. You lived a life of a CEO that sleeps 4 hours or 5 hours, and you're sitting on an airplane. You should be exercising and lubricating the joints. Don't forget, movement is medicine. Mobility is longevity. So you really need to lubricate those joints to avoid a knee replacement. I've gotten many people where I've prehabbed them up to their surgical date. They've actually walked out of the operating room and didn't need the joint replacement. Joint replacement surgeons hate me. They say, you're making me lose money because we're saving people from joint replacements. No, I'm fixing your physics and biomechanics and making you walk normal and fixing your posture, because everyday life, we're bent forward, texting neck. It's a nightmare. Do you know that I've got 20-year-olds who have a neck of a 90-year-old arthritic? It's horrible.
That's insane.
Horrible. Because of our iPhones. We're all looking down. We're stretching that nuchal ligament in the back, and the bones are becoming so arthritic in the spine that we're now doing disc replacement surgeries on 20 and 30-year-olds. It's terrible. From phones.
Shocking. In terms of your cartilage as well, how can we maintain the health of our cartilage and for it not to degrade? Because I think that's a massive factor as well. What's the secret to people maintaining that? So, for example, I supplement with So collagen, hydrolyzed collagen, which I use. Does that help? Is there evidence to support that does actually help maintain your cartilage, or is that just nonsense?
The supplement industry is tricky. It's tricky. It's a $1 billion industry. A lot of this supplement industry is not studied. We have our FDA, not FDA approved, right? So we don't have a lot of studies about collagen supplementation. Does it hurt? No. Does it truly get into the cartilage of the joint and rebuild? We don't have those studies out there.
Right.
Is there some data to support that drinking, and having these supplements helps with cellular optimization? Yes. I take supplements myself. Some vitamin D3 with K2. I do believe that there is a time and a place for supplements. So there's nothing wrong with taking them. You obviously need to, check with your primary care practitioner to make sure some of these supplements don't counteract with your medications if you're taking medicines. But let's talk about cartilage. What does cartilage need? It actually needs healthy joint compression. It needs joint compression. You need to get up and walk. Believe it or not, lying down and sitting is deleterious for cartilage. It causes breakdowns. It really needs that ebb and flow of joint bones touching and moving the cartilage. It likes tensile loads, safe tensile loads. That's why exercising with weights, bands, resistance bands is healthy and excellent for cartilage. So again, I have meniscal tear patients with their medial meniscus or torn knees cartilage. We fix them. They don't need surgery.
Right.
It's really good. So, I would say really be careful. You've really hit the nail on the head, Rob, about biomechanics. And going back to your initial sentence of, structural deterioration, we're really not giving that more credit. And it needs to be in the longevity world. We're talking all these biohacking devices, but let's look at the physics of the human body.
Absolutely. I couldn't agree with you more. I think that's often not spoken about enough. What about in terms of MRI scans? So one of the things I researched and looked into was that often you might have someone that, let's say you might have two patients, both have the same issue, but one doesn't experience pain whilst the other does. And it'll be interesting to unpack why that is the case in terms of biomechanics, that both these patients have the same problem on imaging, but one doesn't have the pain and one does.
As part of my full body musculoskeletal and neuromuscular evaluation, I look at the MRIs with my chief musculoskeletal radiologist. And you are right. We can have the same scan back to back with two human beings with a blown out herniated disc, and one can barely walk and the other one's still walking with no pain. It boils down to looking at the structures that are around the disc, such as ligaments, tendons, connective tissue, muscle, and those muscle forces that are pulling on those ligaments, tendons, connective tissue, and disc. So when you look at those structures, I analyze it to say, what is your root cause of your pain? And 90% of the time, it's not that herniated disc on that MRI. It's not. It's actually something that compensated as a result. So it's the compensatory mechanism that causes the root pain that people just shove under the rug. Now you go and have spine surgery and they're still in the same pain because the surgeon didn't do that. That's not their job. The surgeon is, honestly, truly just that, hammer and nail fixing that problem. They're not looking at the root cause, that it could be the muscle, it could be the tendon. Usually is the muscle, the ligament being pulled wrong. And that's what I do. Realign the body, shift the muscle. I actually turn down a muscle and turn on a muscle like a light switch. There's muscles that are too strong. There's muscles that are too weak. But listen to this. There are muscles that are too long and too short. Do you know that's 4 different things? Strong, weak, short, and long.
Right.
I look at all that And that's the key to longevity, knowing that.
Right. In terms of defining osteoarthritis, that is, from what I understand, as a result of poor biomechanics, right? And is that resulting in inflammation in the joint? Is that what osteoarthritis is? Just trying to understand that.
Correct.
From layman's perspective.
Osteoarthritis, which affects millions of people worldwide, is inflammation surrounding the joint. The knee joint being number one. And did you know that the thumb joint is starting to creep up as the number 2 osteoarthritic joint? It's called the CMC joint because everyone's texting. So we have texting thumb problems. Oh, it's a serious problem. So I, came up with a texting thumb protocol to fix that joint. They're even doing thumb replacements now. It's that bad.
That's insane.
You said overuse syndrome. Overuse syndrome. This is why runners have to stop running. Overuse syndrome. Tennis players have to stop playing tennis. Overuse syndrome in the elbow. But it's all fixable. So osteoarthritis affects all the joints, with the main ones being the knee, requiring a total knee replacement, the hip, requiring a total hip replacement, and the thumb, requiring a total thumb replacement. That's all fixable. We just fix the physics, the biomechanics, we turn muscles off, turn muscles back on, get rid of the inflammation, and your joint is as good as new.
Right. Going back to pain, what's often used to manage these symptoms is, I believe, cortisone shots. What are your thoughts around that in terms of as a form of treatment? It might be helpful perhaps for short-term pain relief, but are you just masking the symptoms?
I would tell you that cortisone has positive and negative effects. There's really a time and a place for cortisone if clinically indicated. I don't like cortisone. It causes a cascade of events that really can weaken ligaments, weaken tendons, weaken muscles. But if needed short-term benefit, then yes, we do recommend it for specific, diagnoses. But I don't like when people come to me and say, well, I had 3 cortisone injections and it didn't work. Of course it didn't work because they weren't getting the root cause. But I'm going to go back to your supplements. There are some wonderful supplements out there that do counteract inflammation. Some natural foods that decrease inflammation, cherry juice and these anti-inflammatory, pineapples and, the berberine, these things that can help. They are indicated. There's a whole literature review of food science. And food science we're not going to discredit. Back in the old days, that's all we had were food. We didn't have medications. We used food to help combat inflammation. So I am not a fan of cortisone. I think it should be a last resort and only if clinically indicated. And then don't forget that it'll start deteriorating joint after joint. So if you didn't get benefit for cortisone, don't go back for more. It's not going to work.
Absolutely. And another study that I was looking at gait speed, I think in over 65-year-olds, I think that's a major factor for increased mortality for your gait speed. So I think it's how much distance you can cover whilst you're walking, I believe. So if your gait speed is slower, that tells you a lot about your longevity and your health span.
You are correct. As a gait analysis expert, gait speed is a big predictor of longevity. We want to keep you walking. We even do something called the 6-minute walk test in our clinic. And we have found subjects in their 70, 80, and 90. If you're still walking, boy, are you going to live to that 100. So it's a really important predictor of longevity along with thigh muscle strength. The girth and the size of your thigh muscle is a big predictor of longevity along with grip strength.
Absolutely.
These frail women that are getting osteoporotic and have no muscle in their lower legs, they're at risk for falls.
Yep.
And
sarcopenia.
Sarcopenia we can talk about. Did you know that 1/3 of the world is at risk for falls? And out of those 1/3 of people over the age of 65 that fall, 50% of the people that fall die as a result of the fall complication. So everyone in my clinic has to perform balance training. It's required. I don't even care if you're 10 years old. We're going to do balance exercises to keep those neurological reflexes adapting to movement, quick speeds, a trip, a fall. So really important predictor, gait speed, thigh girth, and that will prevent, well, what prevents sarcopenia? You just did it. You're going in the gym 3-4 days a week. Get to the gym. Muscles are longevity, for sure.
Absolutely. Obviously, a combination of strength training and cardio is important. What are your thoughts around how that should be combined?
You know, I really kind of get upset at the person that says, well, I golf 5 days a week. That's a workout. No, wrong. That is not a workout. 5 days a week of doing the same thing over and over is just going to create overuse syndrome, repetitive stress syndrome, RSS. You do need to vary it. You do need to do high intensity interval training. Even when you're 90 and 80, something that high intensity interval training can look as sit and stand 10 times, get up from a chair 10 times. That's high intensity interval for a 90-year-old because you're going to breathe deep and heavy. So you should supplement high intensity interval training, cardiovascular training, strength training, stretching. Those are key factors of a workout. Don't just go and walk on a beach 7 days a week. Don't do yoga 7 days a week. It's not correct or safe. You have to vary your workout over and over to avoid overuse syndromes. So very important. In my opinion, you know, our Surgeon General now says 7 days a week. Don't just take a day off. When you go to the mall, park at the farthest spot and walk. Don't take the escalator, take the stairs. That could even be a form of cardiovascular for some people. Did you know that stair training helps that metabolic equivalent? It can be difficult. It's excellent for you. So you do need, I would say, 3 to 4 days a week of cardiovascular, 7 days a week of strength training. Muscles are medicine and longevity. Did you know that building muscle releases these chemicals, these myokines?
Irisin. Yeah,
That's it.
One of them.
It's amazing. It's so important for longevity.
Absolutely, couldn't agree more. What are 3 actionable tips that you would give to any viewer that's watching this at the moment that they could implement in their life to prolong not just their longevity, but optimize their performance in everyday life from a biomechanical standpoint and in terms of structural durability?
The top 3 tips I could give your listeners to make actionable change today is number 1, get up and move every 30 minutes. Set your alarm every 30 minutes that you get up and walk for 5 minutes, or do some mini squats, or toe raises, or calf raises. Every 30 minutes you need to move, definitely. The second actionable change is make sure you're eating enough protein. We are for sure not eating enough, which then won't give the building block to create more muscle. So you should aim to 1 gram per kilogram. I'm eating 130 grams of protein a day in order to maintain my muscle mass and keep my high basal metabolic rate. So be conscious about the food choices you make. Make sure there's protein on every single plate that you have. Don't just skip breakfast. It's vitally important. And the third thing is go to bed at the same time every day. It's so important to get 8 to 10 hours of sleep in order for your body to heal. Those are actionable changes your listeners can do right here, right now.
Absolutely. You someone, I'm just curious, that implements fasting protocols or intermittent fasting. What are your thoughts around that?
I am a fan for intermittent fasting in the initial 90-day algorithm. When you come to my clinic with multiple comorbidities and your cholesterol is really bad and your blood work and labs are so incorrect and I've got to fix the needle, I'm going to do intermittent fasting. Obviously, if it's clinically indicated and you're not a diabetic. But intermittent fasting is a really great tool that can set the metabolic rate, can help you lose weight quickly, safely. So I do believe in it if clinically indicated for someone that I'm trying to reset a whole list of comorbidities. And I've got patients, Rob, that have 25 to 35 diagnoses on one list. It's crazy. And every single one of those diagnoses can be fixed with the letter E, exercise.
Right.
Period. End of story.
Fascinating. One of the things I find interesting, just to tie this episode up, is the point around protein. Because on one hand, yes, I agree, having sufficient protein is important for stimulating muscle growth and repair. But on the other hand, one of the root causes of aging, I believe, is overstimulation of mTOR. And I think this is where fasting plays a role. So on one hand, you're going to have to stimulate mTOR because that's what protein does, right? But on the other hand, having periods of fasting is good in terms of not overstimulating it as well. So I think there's a lot of nuance there. I'm not sure what the science says precisely around that, but I think it's a balance between performance and longevity, I believe.
Absolutely. I think you said it great. Performance and longevity. Are you that elite athlete? Are you trying to perform at a different level? I think we're also talking a little bit about autophagy, right? This autophagy where the senescent cells that we're trying to, kill off.
Senescent cells is also one of the root causes of aging.
Right? So I do believe there is that period of autophagy that helps. Juice cleansing. I juice cleanse. I drink a green juice every single day. I believe is really important. So I think that you need to individualize care. You need to, meet with your clinician, your physician, to get a balanced program that's right for you. Because if you are sarcopenia and you have osteoporosis, you need to eat more protein. You need to do bone density, weight-bearing exercises to reverse osteoporosis, which you can do. You can reverse it through weight-bearing exercises. So I think as we age, I really do believe that intermittent fasting may not be the best thing for you. I'm believing that you must eat 5 meals a day, more snacks, more healthy snacks. Go for that, 10 a.m., hummus and vegetables. You need to be eating greens and vegetables at every single meal also. Let's not forget that fiber in one's diet is vital because as we get older, we're getting constipation, which is a big problem. And I really want to just bring this topic up, but the whole world is starting to become addicted to GLP-1s. And we're on these GLP-1s where I have combated through the Corsa method, the GLP-1 workout, because these people are injecting once a week a GLP to lose massive amounts of weight. Now they're losing massive amounts of muscle.
Yeah.
And their skin is sagging. This is very, very bad for longevity. We must maintain our muscle mass, and I created a protocol to keep that muscle mass on those GLP-1s. So we've got to be careful with these, medicines that we're prescribing over to all of these people.
It's interesting. In what scenario would you suggest a GLP-1 versus not, in terms of, is it a certain body fat percentage?
A GLP-1 is clinically indicated right now for the type 2 diabetic. That's what it was originally used for. Someone who's morbidly obese, can't lose the weight. That is what it was intended for, and it's working. But, now we're giving it to everyone. People that have a normal BMI. Oh, I want to lose 10 pounds. That's not indicated. If you want to lose 10 pounds, get up and move. It's simple math, Rob. Calories in versus calories out. There's no fad here. This diet, that diet, this diet. You are what you eat. Eat healthy. Calories in versus calories out. So the GLP-1s, I think, are indicated for someone who's morbid obesity, that really is struggling to lose weight, and someone that's immobile from obesity as well. I think is important and very helpful for that person. But after that, please stop being lazy. Get to the gym and work out.
Absolutely. In terms of the point around calories in versus calories out, I also think it's important about the macronutrients that you're getting in terms of, because not all calories are equal per se.
Correct. You need to look, that's an excellent point. you should speak to a functional nutritionist. That's part of our program. When you come to Boca Raton, we give you the full program with a nutritionist who's going to help you count the macros, making sure you're eating the good fats, the good fibers, and what time are you eating these foods? Right after the workout, I'm consuming those good carbohydrates and I'm consuming excellent protein, healthy right away to fuel my muscles. I'm not going to sit there and have a sugar-laden meal right after the workout. So I think counting your macros is really important.
Absolutely.
I really believe it.
Fantastic. I think this has been very, very helpful. Is there anything that you think you wanted to cover that we haven't covered?
I'm here to tell you that, honestly, don't be afraid to move. Don't make an excuse. There's no excuse out there. With my Corsa conditioning kit, I made the no excuse therapy. You can exercise anywhere, anytime, any place. I don't want to hear I'm on the airplane. I don't want to hear I have no time. You guys can do this. Just get out there and move. That's what I'm here to tell you.
Absolutely. You have this device here. I just wanted to point to that. Can you explain to the audience what this is?
Yes. So in my Corsa conditioning kit, I came up with 3 or 4 things. I'm showing you 2 of them. The rest of them are on my website. But you can do a full body workout with 100 reps of everything, getting the core, the arms, when you're sitting in the car, when you're at a light, when you're standing in the grocery store, when you're on your long haul flight like you just took to Los Angeles. There's no reason why you can't do these exercises. And I came up with them. They're on my app, ptviphealth.com. And you can get the app, download the exercises, and do a full body workout in 15 minutes. No excuse. Just get out there and do it.
Perfect. Final question. If you could ask any question to the next guest, what would you ask them?
What did you have for breakfast today?
Love that. Thank you very much. I hope you've all found this useful. Please subscribe to the channel if so, and thank you very much for listening.
Thank you, Rob. It was awesome. So happy to spread the word. Biohack Rob, you're great.
Thank you.